In just 9 minutes, uncover the most shocking revelations from Tucker Carlson's explosive interview with Dr. Richard Bosshardt. A veteran surgeon with nearly 40 years of experience, Dr. Bosshardt exposes how declining medical standards, political agendas, and diversity policies are putting patient lives at risk. Stay till the end. You won't believe what's happening behind the scenes. Here are the key takeaways from the podcast. Takeaway 1. Declining surgical competence. Dr. Bosshardt is deeply concerned that many new surgeons are not properly trained to operate independently. Despite spending years in medical school and residency, they lack the confidence and ability to perform surgeries on their own. He believes this is a serious problem that threatens patient safety. For example, a study published in 2014 found that 66% of graduating general surgeons could not safely operate alone for more than 30 minutes. Many struggled with handling tissues correctly, stitching wounds, or identifying early signs of complications. Even more alarming, some had never performed basic procedures like removing lymph nodes, which is a critical part of cancer treatment. Instead of going straight into practice, 80% of new surgeons opted for additional fellowships, often because they did not feel ready. Now let's move to the next takeaway. Takeaway 2. Lowering standards for diversity. Dr. Bosshardt argues that medical institutions are no longer focused on choosing the most skilled and qualified surgeons. Instead, he claims they are prioritizing diversity, equity, and inclusion, DEI, over ability. This, he believes, is leading to a dangerous drop in overall competence in the medical field. For example, he mentions that some medical boards now allow trainees to qualify for board certification by merely observing surgeries rather than performing them. In the past, surgeons had to physically carry out a set number of operations to prove their skill before they could be certified. Now a doctor can list surgeries in their training log that they only watched, not performed. This means that some newly certified surgeons might never have held a scalpel in a real operation. Now let's move to the next takeaway. Takeaway 3, racial matching in medicine. A controversial idea being pushed in medical institutions is called racial concordance. This means patients should be treated by doctors who are the same race as them because it supposedly leads to better outcomes. Dr. Bosshardt strongly disagrees with this idea and says there is no real scientific proof behind it. For example, he points out that a widely cited study claimed black babies had a better chance of survival when treated by black doctors. However, this study has been discredited for its flawed research methods. Despite this, organizations continue to use it as a justification for promoting racial matching in medicine. Dr. Bosshardt warns that this approach is a step backward, leading to segregation instead of focusing on hiring the best qualified doctors. Now let's move to the next takeaway. Takeaway 4. Fear of speaking out. Many doctors agree with Dr. Bosshardt's concerns, but they are afraid to say anything publicly. They fear that if they speak out against diversity policies, they will be accused of being racist and could lose their jobs. For example, Dr. Bosshardt received numerous private messages from fellow surgeons who supported his views, but told him they could not risk their careers by agreeing with him publicly. Some minority doctors also contacted him, saying they disliked being treated as diversity hires because it made people doubt their true abilities. However, they felt pressured to stay silent to avoid backlash. Now let's move to the next takeaway. Takeaway 5, the impact of reduced training hours. In 2003, a nationwide rule was introduced to limit the number of hours that medical residents could work. The goal was to reduce fatigue-related mistakes, but Dr. Bosshardt believes it has made things worse by giving future surgeons less time to train. For example, in the past, surgical residents worked up to 110 hours a week, sometimes staying in the hospital for 36 to 48 hours straight. While this was exhausting, it ensured they gained real-life experience handling critical situations under pressure. Today, residents are limited to 80-hour work weeks, and as a result, they are getting much less hands-on experience before becoming fully licensed surgeons. Studies have shown that reducing these training hours did not actually lower medical errors, which suggests that this policy has done more harm than good. We're halfway through the video. Thank you for sticking with us this far. If you're enjoying it, please give us a thumbs up and share it in your WhatsApp groups. We'd love to hear your thoughts, so feel free to comment below. To see more videos like this, make sure to hit the subscribe button. Now let's continue with the video. Takeaway 6. Surgeons avoiding responsibility. Dr. Bosshardt says there is a growing problem where young doctors see their work as just another job rather than a lifelong commitment to their patients. He believes true excellence in surgery requires personal sacrifice and dedication, but many young doctors today are more focused on work-life balance. For example, some new surgeons refuse to stay beyond their scheduled shifts, even when their patients need them. In the past, doctors would follow their patients' progress closely, taking responsibility for their recovery. Now, many surgeons simply clock out at the end of their shift and leave the next doctor to deal with any problems, which can harm patients who need consistent care. Now, let's move to the next takeaway. Takeaway 7. Politics in medicine. Dr. Bosshardt argues that politics has taken over the medical field. Instead of focusing on improving healthcare, many institutions are pushing political ideologies that influence hiring and training decisions. For example, after the death of George Floyd, the American College of Surgeons created a task force on racism within weeks. Instead of investigating actual instances of discrimination, they made broad claims that the entire field of surgery was racist. Dr. Bosshardt believes this political push distracts from real issues like ensuring high-quality training for all doctors. Now let's move to the next takeaway. Takeaway 8. The surgeon shortage crisis. The United States is expected to face a severe shortage of surgeons in the coming years. Instead of fixing the problem by improving training and making surgery an attractive career choice, institutions are lowering standards to fill the gaps. For example, by 2035, the country is projected to be short by 19,000 surgeons. Already, there are hospitals struggling to find trauma surgeons. Instead of ensuring that young doctors are properly trained, institutions are allowing underqualified candidates to pass through the system just to increase the number of available surgeons. Now let's move to the next takeaway. Takeaway 9. The failure of mentorship programs. In response to the declining skills of new surgeons, some institutions have tried to introduce mentorship programs where experienced doctors help guide younger ones. However, these programs have largely failed. For example, one of the reasons these programs are not working is because they focus on racial matching. Instead of simply pairing experienced surgeons with those in need of guidance, institutions try to match mentors and trainees by race, which severely limits the number of available mentors. As a result, many young doctors are left without proper guidance, further contributing to the decline in skills. Now let's move to the last takeaway. Takeaway 10. The consequences for patient safety. The most serious concern raised by Dr. Bosshardt is that declining medical standards will put lives at risk. If surgeons are not properly trained, the rate of surgical complications and preventable deaths will increase. For example, one of the biggest risk factors in surgery is how long the operation takes. The longer a patient is on the operating table, the higher the chances of complications like infections and excessive bleeding. Many new surgeons take twice as long to complete basic procedures, which significantly increases these risks. Some hospitals are even limiting how much they will pay for anesthesia, recognizing that many surgeries are taking far longer than they should. Here is a brief introduction about Dr. Richard Bosshardt. Dr. Richard Bosshardt has been a board-certified surgeon for nearly 40 years. He's watched the DEI race crazies lower the standards to such a frightening degree that he no longer trusts doctors. Thank you for watching. If you enjoyed watching this video, please leave a like below and share this video in your WhatsApp groups. You can also discuss about this video by commenting below. To get more such videos in your timeline, press the subscribe button below.